Let me ask, do you know someone with a serious disease, with a prognosis of 6 months or less to live if the disease runs its normal course? Are you trying to break the cycle of returning again and again to the hospital or emergency room? Have you seen how a life-limiting illness has diminished your loved one's quality of life? Do you want to do something about this, to move from treating an illness to caring for a person? In this first video of our hospice education series, I want to help you understand what hospice really is. I will explain how specialized teams work together to deliver personalized care to patients and families. I want to help you understand that hospice is a philosophy of care, one that reduces the burden of medical care so patients and their families can focus on what truly matters, their time together. Hello, I'm Karen Rubel, President and CEO of Nathan Adelson Hospice, the oldest, largest, and only nonprofit hospice in Southern Nevada. Over the years, we've learned that when a patient is no longer able or no longer wants to treat their life-limiting illness, their priorities change. What's important now is to find a way to experience the best quality of life. Many people find that hospice is the right answer for them or their loved one. Hospice is designed to meet the specific needs of patients and families during the end-of-life journey. A terminally ill patient and their family often deal with a complex mix of physical, social, emotional, and spiritual needs. We've found the best way to address all these different needs is with a team of skilled professionals trained in end-of-life care. Most families would find it impossible to assemble such a team, so hospice does it for you. These skilled professionals work closely with you and each other to optimize care at every stage. We've produced a separate video that describes in detail the different members of the hospice care team and the important roles they each play. You can find the link in the description if you wish to learn more. When a patient is receiving hospice care, this interdisciplinary group develops a plan of care. Using the plan, the team coordinates regular nursing visits, assistance with personal care such as bathing, as well as emotional, social, and spiritual support. Prescriptions related to pain and comfort are delivered to the home, along with durable medical equipment and supplies such as a hospital bed, nebulizers, walkers, and more. In general, hospice will assist in any way it can to make care as convenient and safe as possible. As a result, you have more energy and opportunities to spend quality time with your loved one. Hospice strives to make patients as physically comfortable as possible while making the most of the time that remains. Yet the end-of-life journey affects more than just the body. It touches all areas of a person's life, as well as their family. Patients and their families face new stresses, which can trigger fear, anxiety, or depression. Hospice professionals help you deal with emotional, social, and spiritual issues. Some of the problems brought on by a critical illness are practical, such as financial strains, job-related problems, insurance, or legal issues. Hospice can help with advice on how to handle these practical hardships too. It's important to know that hospice is not a place, it's a philosophy of care. Given a choice, most people would prefer to be at home when they're ill. It's no different for people with a terminal illness, so almost all of hospice care is delivered in the home. For different patients, their home may be their private residence, or that of a loved one, an assisted living center, or a skilled nursing facility. There are times when inpatient care may be needed. There are several reasons why a patient may be admitted to a hospice inpatient unit. When a patient has symptoms or pain that cannot be treated safely at home, or the patient requires careful supervision only available in a medical facility. Once stabilized, patients can be transported to their home to continue their care. For more information about where hospice care takes place, we put together another video that provides more detail. Just click the link in the description. Hospice is a complex topic, so we encourage you to continue with our hospice education playlist. We put together helpful videos that walk you through topics such as who pays for it, who is eligible to receive hospice care, what to expect, and more. The fact that you're exploring hospice is a very positive sign. It means you're considering what's best for a loved one and their family. The philosophy of hospice is to provide support and care so that people with a life-limiting illness may live as fully and comfortably as possible. At Nathan Adelson Hospice, we do all we can to make sure that no one in our care ends the journey of life alone, afraid, or in pain. Thank you. If you have additional questions, feel free to reach out to us or leave a comment below.